Hi, Jamie Davis here from the Nursing Show here at ANIA 2015 in Philadelphia. We're talking nursing informatics, and I'm very excited to have Dr. Betsy Weiner here from Vanderbilt University. And Betsy, tell us what you do at Vanderbilt, and then tell us a little bit about your background as a nurse.
I'm the Senior Associate Dean for Informatics at the Vanderbilt University School of Nursing. I've been in technology for a long time, well before informatics was a recognized program or degree. So while I do push that I think informatics people today need to have a degree, my degrees aren't in informatics. I'm one of the early pioneers who pushed for that curriculum and began to do multimedia development early in the 80s because I felt like our students needed some better guidance about how to do clinical decision making. So I jumped right into doing video discs, if you can believe that, so that they could see the positive and negative outcomes of clinical decisions that they were making.
Excellent. So we were talking a lot about being a member of the organization ANIA and why it's important for nursing informaticists to be specialized in their career, but that means education. So why is it so important that we really push to have nurses in the informatics role be trained at the graduate level?
I think the biggest reason is there's been some interest in technology that their organization has pushed them towards that informatics route, but they don't really know what it is. How do they get that data flipped over to information, and how do they look at those patterns and decide when they have enough knowledge? How do they get the basis upon which to make the best informed decisions, and how do they find the evidence? Those are the things that we build into programs. With the new doctorate in nursing practice degree, we've had people come and say, well, I dibble-dabble in informatics, but I don't really have a master's in that. Should I, before I go on for my doctorate in nursing practice? And we say yes, because you've got to have that strong foundation.
Right.
Otherwise, if you try to build on that for population-based management, for the other quality improvement principles, the things that you want to do to make a difference by being an informatics nurse and knowing that you can directly affect patient outcomes with the knowledge you possess. So we think it's important.
It is important, and I see it in all specialties. You wouldn't ask a nurse to come in without having that foundation in anatomy and physiology at the basic level as an RN or as a BSN. And so similarly, you can't have a nurse informatics specialist without having that strong foundation, that educational background in informatics.
I think you're right. And we fight that battle that most people don't understand what informatics really is. My own mother, who's going to be 90 this year, says, well, I think I'm finally understanding what informatics is because I've been in it since the early 80s. And sometimes it just takes some time and examples of what informatics can be. And it's not all about the electronic health record. That's one small piece that nursing informaticists can contribute to.
Absolutely. So what is the last question here is just kind of, what is that person that's looking for that graduate program in nursing informatics? What are some of the key things they should be looking for in the programs maybe they're reviewing before they choose one to start with?
Well, I think they have to look at the quality of the faculty that will be teaching them. Most of them want to work full-time, so they're looking for online programs as well. The days of having to actually move to a place and have a residency requirement, those days are gone. They'd like to have a place where there's some decent financial aid to give back to them. I hate the thought of our nurses having to carry that debt. Some of them already having carried debt from going to school for the prior degree. So those are just some things to consider in that regard.
Excellent. Well, thank you so much for coming in and chatting with me briefly here. I appreciate it, and I continue good luck to you. Hopefully, we'll continue to push for nursing informaticists to get that degree basis, that graduate degree, to move forward and support the entire profession.
Absolutely.
Great. And I want to thank all of you for checking this segment out here from ANIA 2015 in Philadelphia. Remember, you can find more segments like this one both on the channel you're watching now or over at NursingShow.com.